Hello, and welcome to today's webinar on COVID-19 risk to individuals with PWS with Dr. Jessica Duis and Dr. Stephen Hawkins from Children's Hospital, Colorado. During this webinar, Dr. Duis and Dr. Hawkins will address general information about COVID-19, preventative measures, the risk in individuals with PWS, and offer general mental health support and resources during this challenging time. Before we begin, a few notes about participation. My name is Andrea Lucy, and I'm the Membership and Chapter Coordinator at PWSA USA. Your audio was muted when you joined the call. Questions can be submitted via the question box on your screen. We should have ample time for questions after the presentation. In 1975, parents Fausta and Jean DeTierling learned their child had Prader-Willi syndrome. A referral to the Child Development and Mental Retardation Center, now the Center for Human Development and Disability, at the University of Washington brought the DeTierlings together with other parents and professionals acquainted with the syndrome. Together, these committed individuals formed a group called the Prader-Willi Syndrome Parents and Friends, now Prader-Willi Syndrome Association of the USA. 4 decades have passed since PWSA USA's founding, and we remain unique in the terms of the breadth and depth of all that we offer. For over 40 years, the commitment and support of our community has enabled us to fund life-changing research, deliver life-saving resources and support, and spread awareness and education to make the PWS community stronger than ever. PWSA USA continues to be a self-sustaining, internationally recognized leader, empowering those affected with Prader-Willi syndrome to enjoy a productive life in an informed and accepting community. PWSA USA is a collaboration of families, individuals, researchers, healthcare practitioners, and professionals working together to strengthen efforts in the areas of awareness, family support, research, education, and advocacy. These 5 pillars serve as the foundation of who we are, what we do, and what we can yet accomplish as we work together to improve the lives of those affected by Prader-Willi syndrome. It is now my pleasure to introduce our presenters. Dr. Jessica Duis is a pediatric geneticist trained at Johns Hopkins in Baltimore, Maryland. She focuses on the management of chromosome 15 disorders and founded the comprehensive clinics for Prader-Willi and Angelman syndromes at Vanderbilt University Medical Center in Nashville, Tennessee. She recently transitioned to Children's Hospital, Colorado, where she continues her career with this focus. She is passionate about the long-term care plans and establishing standards of care for individuals with PWS. Dr. Stephen Hawkins is a sleep pulmonologist trained at the University of Colorado. He has expertise and interest in managing obstructive sleep apnea in individuals with PWS. His research has included substitution of high-flow, heated, humidified air via nasal cannula in the treatment of OSA. He is a provider in the multidisciplinary PWS clinic at Children's Hospital, Colorado. Welcome. I am now going to give controls over to Dr. Duis. Thank you for taking the time to be with us today.
Thank you so much. This is Dr. Hawkins. Andrea, can you actually give that over to me? And I will get us started for clicking.
Yes, sir.
Great, thank you so much, and thank you all for inviting me and having me. I would like to first off thank my co-presenter, Dr. Duis, who did the lion's share of this research and summary slides. So I'd like to thank her in advance for putting all this together. I'm going to start by figuring out how to click, and there we did. I did that by showing you the outline as Andrea outlined, which is to briefly discuss information about the coronaviruses in general, specifically mention why COVID-19 has gotten so much attention, and deservedly so, how this impacts our family and friends and patients that have Prader-Willi syndrome, and then I'm going to hand it over to Dr. Duis to discuss preventative measures as well as the mental health support and resources that we could be providing our families and friends, both with and without Prader-Willi syndrome, but specifically our kids with PWS. And so coronaviruses in general are actually not nearly as interesting as this one would make you think. We see several of them on a cyclic seasonal cycle. The reason that this one is in particular so interesting and has been so devastating is because it has traveled from animals onto humans, and that is what makes it novel, whereas it used to be more of a zoonotic animal virus and it has now transitioned into humans. And it's because of it being novel and not previously seen by humans and our immune systems that it's capable of causing such significant disease. This has happened twice in recent past. In 2002, it was first seen in China and then spreading in that area into a few other countries less so, but was the SARS virus, and that's was the first SARS virus. That virus is interesting in that it had about a 10% case fatality incidence, which is quite high. The Middle Eastern respiratory syndrome, which does continue to be found, though rarely, on the Arabian Peninsula, has also been found to be, again, quite dramatically fatal with about a 34% case fatality rate, but it has been limited to the Arabian Peninsula. Of interest, these animals that have been found to be harborers also vary. For example, camels are found to be the animal that have been harboring this Middle Eastern respiratory syndrome. So as I mentioned, the coronaviruses themselves are actually not as rare and devastating as this one would have us believe. They actually can be quite common. This graphic is showing us why we even call them coronavirus. Corona is from the Latin for crown-like, and that is describing this cartoon on the top left, where if you were to look at it under an electron microscope, it does look like it has the little spikes of a crown. The coronaviruses do tend to be seasonal, respiratory, illness-causing, and when, as I mentioned, they travel from one host to humans, they become novel. And so you've heard all of these phrases being described. The 19 for COVID-19 is describing the subtype of this coronavirus. COVID itself just being an acronym for coronavirus disease, which is not particularly helpful. And so you're hearing different names coming out now, and the most, I think the most widely accepted now is the SARS-CoV-2, which tells you both what it does and that it's the second of its kind. Here on the right, it also describes the setting in which these cases often arise. We've heard a lot about the wet markets in Wuhan, where these varieties of animals are kept in close contact, and the families, or excuse me, the people that are working in these facilities are not necessarily using the kinds of PPE that has become to be so commonly talked about. And so how does this travel? Once these viruses have made this leap to be able to infect humans, how are we then spreading it? Well, after it's made that first transition into the human population, it and many other viruses like it, in fact, are spread by one of two most prominent ways. The most common and the one that we typically think of is by cough or sneeze, where droplets of mucus or saliva carry the virus with it, and that those can then be inhaled directly by another person into the mouth or nose, often depositing into the airways. This distance, there's both an issue of distance and how long the virus can survive under these conditions, and I'll talk about that in just a minute. But the range of this cough or sneeze has often been reported to be about 6 feet, and it's unfortunately the case where we're finding that it may actually be more than that. It may actually be as much as twice as far that these viruses can actually travel on droplets. And so all the more reason why the distancing and social distancing has become so important. The second mode of infection is where these droplets that contain viruses land on something, that those objects are then handled. And so now we have droplets with virus on our hands, and that then we touch our face, our eyes, our nose, our mouths, and that the virus then enters our airway and respiratory tract by that means. And so this is why cleaning, aggressive cleaning of surfaces, frequent cleaning of surfaces and objects that are used with any regularity has become so important, and the frequent references, encouragement to not touch your face. I feel like this would be a great opportunity to put in some kind of a meme, because all of us have had friends that have passed along these funny memes joking about not touching your face. But I'll try to refrain and keep it professional. I mentioned that the droplets have both a distance that they can travel on droplets and survive, and a duration. And so this is showing a handful of scenarios um, where the droplets may land either on a metal surface like copper or steel, a paper surface like cardboard, or a surface such as plastic. And so we're going to focus on the red because that is addressing the SARS-CoV-2 virus that we're currently interested in. And this is showing us how long the half-life is of the virus in these aerosols. And so the SARS-CoV-2 in general survives for 1 to 2 hours, or has a half-life of 1 to 2 hours, which means it can survive for several hours after it has been deposited. But after about 2 hours, that there's very little virus surviving. What is not yet known is how much virus does it take to actually make someone sick, which is a third factor that we don't yet have much information on. I'm going to skip copper because that's not a terribly common substance to be handling, but there's certainly concerns about paper, mail, Amazon packages, delivery, etc. And on cardboard, the SARS-CoV-2 does have a little bit of a longer half-life of 3 to 4 to 5 hours, and so it can survive on paper. Most concerning is its ability to survive on stainless steel and plastic with a half-life anywhere from about 5 to 7 hours, which means that it can survive for quite a while without being cleaned in that scenario. Again, this is why prevention and methods for prevention are so important. And so this is a placard developed by the CDC initially in response to people traveling from areas where there were high rates of this novel coronavirus. We have since removed the concern for travel because it has become clear how this has spread so quickly without testing. We did not even realize where it had gotten and how quickly it had gotten there. And so the travel itself is not as important as the list of plans for what one should do or should have done in the case of traveling from a high prevalence area, including this 14-day self-quarantine, practicing social distancing, monitoring for fever, and avoiding contact with others. In the event of developing these symptoms, there's the plan to, again, maintain distance, keep your symptoms to yourself, and to contact your doctor's office if you were having serious symptoms. The symptoms have generally, or have in pediatrics, we'll talk about this in a moment, but have fortunately been quite mild and have been more severe for the adults. They do tend to appear anywhere from just a very few days, unfortunately up to 12 to 14 days after exposure, which has been one of the hardest issues in that people do remain contagious for a very long time and may have a very long time of being asymptomatic but still able to share the germs. This shows 3 of the prominent findings: fever, cough, and trouble breathing. I'm going to show you a longer list here where the cough is in particular dry, meaning it doesn't sound wet or rattly or productive of mucus. The fever has gotten a lot of attention. Difficulty breathing, often described as shortness of breath, getting out of breath quickly. Pneumonia has been a common presentation in adults. Diarrhea and nausea were surprising findings to find this kind of GI upset in a minority, but still worth mentioning. Loss of taste and smell has actually become a very interesting, very common finding in coronavirus that is quite unique and has been a potentially helpful symptom in deciding whether or not someone has coronavirus versus something else that might also act in these ways. And headache. You'll notice that this list of symptoms sounds very much like seasonal flu, which is still this is still the season for, among other viruses. It also here in Colorado, as of the end of last week, had a very high pollen count, and so allergies started to flare up. And so one way to think about a difference between the coronavirus symptoms and allergies is that sneezing or runny nose, itchy, runny red, watery eyes, these are very characteristic of allergies, but not necessarily overlapping with this coronavirus. Runny nose in particular has been very uncommon in patients with coronavirus, and so is more likely related either to allergies or to some other virus. Now to think specifically about children, we have been fortunate, very fortunate in the pediatric population where children have been a minority of cases, whether we're describing the Chinese experience, the Italian experience, or the very few more global reports about how this is impacting children. It's generally been much less than 5% of positive cases. One quick side note there, that this is relying heavily on testing. And so as we all are made aware through the media, testing has been a very challenging issue due to limited amounts of test kits and limited access to these tests and labs. And so we are often having to rely on those that are sicker being the ones that are getting tested. There was a community study in Italy that suggested that children are primarily a vector, that they are getting this virus, but that they are not acting sick at all, or they have very, very mild symptoms. And so I think once this is all said and done, we're going to see that more people than we even realize have actually had it, but that the majority have been on the much milder side. Getting back to the points outlined here, as I mentioned, the cases have been significantly milder than those in adults. The reason for this has to do with those spikes. Those spikes are proteins that attach to certain receptors. You may have heard about ACE or angiotensin receptors that are found in the body. And the way those receptors are expressed in the body does change with age, where children seem to have a protective presentation. It is not yet clear at what point that protection starts to wane, though it certainly seems to be that those that are older than 60 or 70 years have a much higher risk than anyone that is less than 30, 40, or 50 years old. Death overall is actually quite rare. It is probably far rarer than the prior SARS or MERS viruses have been, which is fortunate. And then in children, it has been even more so. It is incredibly uncommon to have even serious illness. For example, in our Children's Hospital, Colorado, we have experienced so far only 5 or 6 children in our hospital that have been positive for this coronavirus, and only one was sick enough to have ended up in the ICU. And out of all of them, I, as a pulmonary and sleep medicine provider, frequently taking care of children that require ventilators, BiPAP, etc., have not been called to help take care of any of them. Again, speaking to the rarity of significant respiratory symptoms or sequelae from this virus in children. We do still see that they tend to have fever and respiratory symptoms, though the development of a pneumonia has been uncommon in children and has been typically limited to adults. There are some non-specific findings in blood work that do show inflammation and low white blood cells, though both of those findings have been, again, fairly non-specific and fairly rare. When we think specifically about our children with Prader-Willi, it is important for us to really emphasize and strongly state that, that so far as we know and can tell now, that individuals with Prader-Willi are not at a higher risk of getting the SARS-CoV-2 virus. There's no literature suggesting that there is an immunodeficiency in this population. And so the higher risk that Prader-Willi syndrome kids have is as they would have for any other virus. And so the things that do put these kids at risk is the lower tone, particularly of the respiratory musculature, that decreases the efficacy of cough and that places them at a higher likelihood of developing a pneumonia. These kids may not necessarily have as early or as prominent of a fever because of the hypothalamic, the central nervous system dysfunction, that may be a less prominent symptom. There may be, with again emphasizing that these are symptoms that place Prader-Willi at overall at a higher risk if they were to get ill with any virus. They are more likely to have aspiration when they're sick, and that obesity and hypertension do potentially increase the risk for a worse outcome, but that these again have been limited to those that are older and have significant comorbidities. Of note, we've seen in the media, there's been only one child reported with Prader-Willi syndrome who was a high school student. He was sick enough to require mechanical ventilation, which is, as we know, has not been a good sign. It's been a very ill omen, but that this child was extubated and has been expected to make a full recovery. So this is our friend Mr. Trimble, who lives in St. Louis, and again, here he is as he's about to walk out. I'm going to pause here and say that again, the risk factors that our children with Prader-Willi syndrome have places them at risk for any virus, and so far as we can tell, this virus does not have any sort of increased risk. And again, if anything, the fact that our children have less of this certain type of receptor is probably protective. I'm going to highlight that the Prader-Willi Syndrome Association website has actually got a wonderful list of resources specifically answering COVID-19 SARS-CoV-2 questions. And so I'll refer to you here. And this is another great picture of the virus itself showing those spiky crown-like proteins. So what do we recommend our families look out for? This is a long list of detailed symptoms. These are not specific to Prader-Willi or to this coronavirus. These are simply the symptoms that we ask families to look out for with any illness that would suggest that there is a serious illness going on. And so you'll notice that the fast respiratory rate that varies by age. Babies are expected to breathe much quicker than older children and adults. And so if you have up to about 1 year of age, they should be breathing well below 50 breaths per minute. Once you have toddlers, they should be breathing below 40 times per minute. And once you get to be school age, they should be breathing less than 30 times per minute. And this has to be when they are calm and not upset, crying, yelling, talking, etc. A fever that lasts for more than about 3 days is concerning for some other kind of underlying infection. Poor mental status, lethargy, true lethargy being not responding to typical stimuli like sounds, voice, touching is very concerning. Any kind of blood work that would suggest abnormal metabolic function, so enzyme changes in either heart, liver, or other enzymes that suggest significant inflammation do catch our attention, as does acidosis. This is a process that's akin to dehydration, where the blood becomes actually more acidic, and that is suggesting that there's both a derangement in potentially the respiratory function or the kidney function. Chest x-rays, and so this is once we start to, again, getting into testing and chest x-rays, what we would be most worried about is the diffuse or findings of infiltrates, and so that's what makes us think most about a pneumonia or airway inflammation or fluid such as an effusion. Age has a huge role to play. Where the younger a child is with certainly any of these symptoms, we have a much lower threshold to be more aggressive, to watch more closely, and to try to do other things. Any other signs, extrapulmonary complications could include anything from vision changes, headaches, GI upset, dehydration, intolerance of feeds, etc. And certainly if there's more than one infection, that would make us have a lower threshold to potentially do more testing, do more evaluation. Again, I'm going to emphasize that this is not unique to coronavirus. These are the signs and symptoms and evaluations that we would look out for any child that is sick with any particular virus or bacteria. To carry us on to from prevention onward, I'm going to switch it over to Dr. Duis.
Thank you, Stephen, or Dr. Hawkins, for joining me for this seminar, and for also to PWSA USA for allowing us to come and talk about COVID-19 during this very challenging time. I want to emphasize something that Dr. Hawkins already mentioned several times, which is prevention is key. And so this is from the CDC. In particular, washing your hands frequently for at least 20 seconds is very important. Preventing close contact remains our best defense against this virus. And I can't emphasize enough the importance of the social distancing and staying home. If you are going out, not taking your child or adult with PWS with you. And I know this is very, very challenging. It's hard to be stuck in the house, and I know people are getting very stir crazy at this point, but that is our best defense to prevent this virus from spreading and overwhelming the healthcare system. This does include preventing social gatherings even within neighborhoods. So we don't recommend that you have neighbors over, that you stay socially distanced within your own family unit. And the reason for this is that there are a lot of people, in particular children, that are transmitting the virus to people at risk for severe disease without even knowing it, without even having any symptoms. As Dr. Hawkins said, we have been saying keep at least 6 feet from others. So if you're going to the grocery store, you're out in your neighborhood taking a walk, to keep away from people. And it may be that this virus can travel even farther. There's some reports in the literature now that it can travel up to 13 feet. So we do want to emphasize the importance of this. Also, not touching your face, which is very difficult. A lot of us don't even realize we touch our face frequently. And so making sure you're constantly washing your hands. If you're touching boxes, for example, Amazon boxes that come in your house, or groceries, making sure as soon as you unpack things, you're washing your hands right away. If you are out in public, especially, but also even within your own home, making sure that you're covering your mouth and nose when you sneeze. And then if you're out in public, again, wearing a face mask or a cloth bandana or something over your face. This is not to prevent you from getting sick, and it is not very effective at that. But what it is effective at is that if you are asymptomatic, but you do have the virus, it prevents you from spreading your droplets around, for example, at the grocery store. We do not recommend putting a mask on children, especially children who can't take the mask off. So especially with Prader-Willi syndrome, we often see kids with low muscle tone. If you feel like your child would not be able to respond appropriately and pull the mask off if they were having difficulty breathing, we recommend not covering their face. You want to clean and disinfect surfaces daily. We think that your regular Clorox and cleaners do eradicate the virus, so get rid of it off of those surfaces. And actually, within my neighborhood, I'm seeing a lot of kids still playing at the neighborhood park. These parks are not being disinfected appropriately. And as Dr. Hawkins presented, the virus can stay for many hours on metal surfaces. So you want to be really careful, and I would recommend avoiding parks and playgrounds. So this is a list of different interventions that have been studied so far in the literature. This is a pre-publication, so that's why it has the writing on the side, but you can see what the most common therapies are available right now, or we mostly have supportive therapy available if individuals get sick enough to require hospitalization. Some individuals with Prader-Willi syndrome are already on oxygen at home, and so you can take their pulse ox and see what their oxygen saturation is, and you can provide oxygen at home. Some of them are on that at baseline, which is very common in Colorado, for example, because of the high altitude. Other supports is making sure that individuals are getting good nutrition. So making sure that if your child's dehydrated, that you're treating that appropriately, seeking medical care appropriately. If there are other super infections, so other infections, and this can be indicated by prolonged fevers or worsening symptoms after a child is getting better. It could be indicative of a bacterial super infection or a bacterial infection on top of COVID-19, and those should be treated appropriately with antibiotics. Antibiotics, of course, don't provide any defense against the virus itself. And you can go down this list and look at many other interventions, from significant interventions, including ventilation and ECMO, extracorporeal membrane oxygenation, is a way that is kind of a machine that allows the heart and the lungs to rest, that we can use in the hospital. What I want to direct your attention to is many experimental treatments, and there's a lot of out in the press about these experimental treatments. A lot of them are geared towards turning down the immune response to the virus, which we think plays a big role in how sick individuals get from the virus. And none of these have a lot of evidence so far, but there are an alarming number of clinical trials that have come about. So, and I'll mention those here. So there's about 366 registered clinical trials now on clinicaltrial.gov. And if you think about the evolution of clinical trials, even within this community, that is an alarming number of clinical trials that have come about since the start of this virus, which was just noted in China in December of 2019. But there's also a lot of misinformation out there, and I know many people are following this information, and it's really important that we try to get some data, but at the same time, if someone's critically ill, a lot of times there are interventions being tried to try to prevent the most feared consequence. We are still not sure if this virus is seasonal. So as you know about the flu comes every year, sticks around until, the beginning of summer almost, and then is gone until the next respiratory viral season, which starts in the fall. And that we know that the flu also mutates. And so every single year we have to develop a new vaccine for the new strains that we think will be in the environment for influenza that year. The good news about coronavirus is, even though it's traveled across the world, it does not seem to be mutating. And so it seems to be a very good candidate for a vaccine. It will likely take time, but there are companies that are actually ready to go for clinical trials, and we'll have a combined phase 1, phase 2 trial starting in May. And we do strongly recommend, when the vaccine becomes available, that you have individuals with PWS get that vaccine. And the reason for that is that while they may not be at higher risk of contracting the virus, as Dr. Hawkins said, our biggest concern is that, just like with any respiratory virus, their outcome could be worse because of some of the things that were already mentioned. So I'm going to switch gears a little bit and talk about something we're all facing, which is the mental health consequences of staying at home and being out of routine, which certainly has an impact on all of us, but for individuals with PWS is extremely challenging. The first thing that I want to say to all of you is that as a rare disease community, I know this population very well to say that you guys are very resourceful, creative, and resilient. In many ways, the rare disease community is more equipped to handle something like this than the general population. You guys brainstorm, you're determined. We learn so much from all the parents out there that are constantly brainstorming new ways to deal with changes in routine or behaviors. So the things we can say to try to help are make sure you're planning ahead. So I want to emphasize this, and I really can't emphasize this enough. Don't avoid care that is needed. So most of the time, it's not going to be something related to COVID-19, but it could still be an emergency. And it's really, really important that you at least have close contact with your pediatrician or your PWS specialist to make sure that you're staying in touch. And one way to do this has been telemedicine. And many medical centers, including Children's Hospital Colorado, has really ramped up telemedicine very, very quickly. And this may be the silver lining to this pandemic, because this is something that insurance companies and medical providers and academic institutions and general pediatricians were actually very uncomfortable with before this pandemic. But now we're all seeing patients through telemedicine, and it's actually been quite successful and helpful, I think, to families. So I would strongly recommend that you request these types of visits from your providers. And we do want you to try to avoid the emergency department if possible. The other thing in terms of planning ahead is really to request refills. So if you're coming up with needing a new refill, see if you can through your insurance company and if you can, have your provider do a 90-day supply so you don't have to keep going out to the pharmacy. However, many of the pharmacies have changed their policies and are offering delivery for medications, and they're waiving their fees currently. If you do have to take a trip to the emergency department, you want to make sure that you're doing all the things we mentioned: washing your hands, have a mask or bandana or cloth over your face, over your child's face if appropriate, making sure you're still keeping that distance between 6 to 13 feet. And the other thing we can do for you as providers is call your provider and say, you think you need to bring your child to the emergency department. And if that's necessary, then they can call ahead and say, this individual has Prader-Willi syndrome. Let me tell you a little bit about Prader-Willi syndrome, and make sure you bring this individual back from the waiting room immediately so you don't get exposed to something in the waiting room. Bring your medications, your tube feeds, and a list with you that includes all your child's medications, what they're on for their feeds. This can be really helpful to getting that information to medical providers, making sure mistakes aren't made if the emergency room is busy. The other thing is, some medications hospitals may be having difficulty getting supplies of, or if your child's on any special medications, you want to make sure you bring those with you. You also do want to ask about visitor restrictions before you go. A lot of hospitals have implemented either only one parent's allowed to be there. Certainly siblings at this point are not allowed to be in the hospital with parents and a child with PWS. So you want to plan ahead. And again, staying connected with your providers. We want to be accessible during this stressful time. We want to make sure that we're doing everything we can to help you stay at home safely. And a lot of people have had questions about how do we present this information to our child to try to explain why we're stuck at home. Why can't my child go to school and see his or her friends? And one way to do that is a social story. You can actually make one that you think would appeal to your child, or you can find many online. This is one that I found online that really breaks it down. You can find these social stories at many different levels, depending on how much information you think your child would like to have and what they can understand. But this goes through it as a story of, this is what COVID-19 is. It can make people feel sick. People can have cough and fever and flu-like symptoms. And the reason we have you stay home is that we want you to be strong and healthy. And these are the things you can do to stay strong and healthy. The other thing that can really help is that individuals with PWS really are such kind-hearted helpers, and they want to be out there helping in the community. So giving them things to do at home that can help other individuals who are sick has been very successful. So have them make cards, or have them do other art projects to make, flowers out of tissue paper and things for other individuals who have been sick. And I can't emphasize enough, as is always true for, children and individuals with PWS in particular, keeping a routine is very, very important. So creating a visual schedule where you could have a picture of what the day is going to look like is very important. And these are just some tips of what the day could look like. So we really recommend limiting academic learning to 60 to 90 minutes per day. That means if you're doing reading, math, phonics, you want to really limit that time to a short period of time with breaks in between. It is very challenging, I can say, as a parent to homeschool kids and be the teacher. So I have a lot of respect for people who do it on a regular basis. But being in that role and concentrating teaching to that short period of time can be much more effective. You want to teach other things. So other activities of daily living, create a reward chart and have chores every day that you want your child to complete. And then the other thing is, this is a special time in a way where you can really, a lot of people are home when they usually would be at a very fast-paced job, which I know is challenging, but it's a nice time to try to enjoy time with your family. And as a caretaker, I can't emphasize enough the importance of giving yourself a break. This is really not the time to be trying to get the work done that you have been meaning to do for years. In order to take good care of your child with PWS, or your children in general, you need to be thinking about and taking care of yourself. That means sleeping regularly, showering, watching movies that you've been meaning to watch. And then the other thing is, it is really hard not to have that parent-to-parent time or have the support of your friends. Maybe you used to once a month have a girls' night and you're not doing that anymore. And we would really encourage finding a way to still do that virtually. So Google Hangout or some of the other programs that are available for free are a good way to do that. Make sure that you as a family are getting outside. So getting fresh air is very, very important. You want to make sure that you're taking the appropriate precautions, but especially for our mental health, getting fresh air is very important. And then staying active is so important. We recommend at least 60 minutes a day getting up and being active. And there's a lot of fun things. You can find all these things for free on YouTube. You don't have to download the apps and pay any money for them. But Cosmic Yoga, Go Noodle, Jack Hartman videos where he gets kids up and learning things while they're active. Those are all just examples of ways to stay active if you're in the house. The other thing is that mindfulness can be extremely effective, and there's many free apps out there that can help you to do this. I've been using Headspace myself, which is available, which has meditation. And along with mindfulness, that staying active together with mindfulness can be very effective treatment for our mental health. The other thing is, it's okay to watch the news, but I would say try to avoid some of it. It's maybe pick one news outlet and watch it one time a day, and otherwise shut yourself off to it. And This includes Facebook. There's so much stuff on Facebook, and a lot of people are getting antagonized. Try to stay off social media. So maybe allow yourself a very small period of time and focus when you are on social media with connecting with people, not trying to get news about coronavirus or what people are doing, whether they're staying inside, because that can be very antagonizing and stress producing when it doesn't need to be. There are lots of really cool activities and resources right now that are actually free. And so that is something that is something that might be really fun for your child. For example, lots of animal options, different zoos. I put one on there every day at 11 o'clock. The Brookfield Zoo has a Bring the Zoo to You broadcast, which I know individuals with PWS might really enjoy. But there's all kinds of options, and I just listed a few, but you can find them online. Mo Willems, that does drawing for children's books, has free drawing classes every day around the lunchtime. If you Google that, you can find it. And lots of free science materials, experiments you can do at home. So lots of options if you're looking for things to keep you busy. So I'm going to stop there, and we'll be happy to take any questions.
Thank you, Dr. Duis and Dr. Hawkins, for your presentation. If you do have any questions, please feel free to submit them via the question box on your screen. I do know that we had a couple questions coming in during your presentation, and we had some submitted beforehand, so let me pull those up for us. Are there signs and symptoms of COVID-19 the same for people with PWS? I think we covered that one pretty well during your presentation. How about how many points over the baseline temperature do you consider a fever that is high and would need to go to the hospital?
I think that's a really challenging question to answer. A lot of parents know what their child with PWS has as a baseline temperature, so what their temperature usually runs. And if you think about, I mean, it's so hard to answer that because of the hypothalamic dysfunction can be different in different people, but I think you have to take it as a, as a full picture of what's going on. If your child feels a little bit warmer and their temperature's up a couple degrees, but they're playing and active and acting like their usual self, then it's something you can probably observe. But if the temperature's up, 5 or 6 points, and then you're also noticing that the child's not acting normal, not getting up and playing, then that's something to be more concerned about. I would say in those situations, calling your pediatrician or your doctor that you see regularly and discussing the situation and making a decision from there whether the child needs to be seen is probably the best way to handle it.
Thank you. We have a question from Vanessa. Is there a particular reason why someone with PWS is getting the virus and recovering versus another person catching it and passing it on?
So if I understood the question, it was asking specifically about children with Prader-Willi syndrome getting it and passing it on where somebody else may not. Is that right?
I believe so. I guess what is the difference between one person catching it and recovering well and other people being asymptomatic and still being able to pass it along?
I understand. So, we don't know if that affects children and young adults and adults with Prader-Willi syndrome differently, but what we are seeing is that in general, the youngest kids are able to have the coronavirus experience and may still be able to pass it on. And that from what we can tell, it simply has to do with those receptors in the way that the virus interacts with their immune system, where it is not making them as sick. And so this is one of the things that makes this virus particularly interesting is that because we've not experienced it and it's very infectious, there are estimates that one person with the virus could get somewhere between 3 and 10 or 12 people sick with it, which is much higher than the seasonal flu, which is only one person typically only gets 1 to 2 people sick with it. And so I think that it has to do mostly with the person who is sick with it. It has to do with those preventative measures, how active they are in taking those preventative measures, but it also has to do with how sick has it made them? Are they coughing more? Are they breathing more, sneezing more, doing those things that spread more droplets that are laden with virus in it? And so I hope that answers the Veronica's question.
I would just add
Great.
to what Dr. Hawkins said, that anybody can transmit the virus. So even if you're asymptomatic, um, or if you're having bad symptoms, while the person with bad symptoms is probably sneezing and spreading more droplets potentially, that individual who's asymptomatic spreads the virus just like someone who's very sick from it. And this is, yeah, again, where social distancing is so important. And I can't emphasize enough that what we're seeing is that if individuals are at social gatherings, because of how infectious this virus is, how long it sticks around and how far it travels, we've seen single individuals go to, a bridge game with 60 people in the room, and every single person who was at that bridge game gets it. So it does travel quite a bit, and it doesn't matter if that individual was symptomatic, they're still breathing in the air, and those droplets still can travel.
Thank you. We have a question from Morgan. If we were to end up in the hospital due to COVID-19 with our child, or if our child with PWS ends up in the hospital, is there anything specific we should be telling medical personnel in regards to their care?
So the biggest things would be making sure they understand some of the things that Dr. Hawkins already talked about, for example, the low muscle tone, the inability to cough effectively, and the fact that individuals with PWS can be very sick without seeming sick until they're on a ventilator. And so making sure that providers are aware that kids with PWS don't have a normal pain tolerance, don't have a normal amount of a fever, and making sure that people are aware that they could be much more ill than they are appearing until they, again, need basically crash and need significant support.
I would echo that as Dr. Duis described, and I would also say that you as the expert on your child and your family, I would suggest that you present everything in a way that is relative to your baseline, to your experience. And so the question might be, has your kid had a temperature of 101 or higher? And your answer could be no, but their baseline is blank and they're now several degrees higher than that. And their baseline activity is this, and this is how I'm seeing that it's different. And that in typical, or in the past, when they've gotten sick with respiratory viruses, this is how I've seen them respond, and this is how I've seen them get better. Along those lines, if you do have experience with CPAP or BiPAP or supplemental oxygen or breathing treatments or any other kind of treatments that are helpful during times of illness, to bring those with you, to bring them up, and to make sure that those interventions are mentioned to the providers early on.
Thank you both. And I do want to add that on the PWSA USA website, we have a medical alert book that you can print and take with you. And we also have a medical A to Z questions and answers that you can look up and keep on you as well. We have a couple questions coming in from a couple of different people asking about who they can see and who is recommended they be around, such as, can I have my boyfriend over? My dad is an essential worker. Should he avoid us? So who would you recommend stay away, or who do you see at this time? What would be the restrictions on visitation and people?
This is a very tough one to answer because it's a very personal decision. Um, but we are recommending that people who live together and have to work in a scenario where they're an essential employee and therefore have to be around other people, that should be it. For example, we are discouraging social gatherings of any kind, and that's unfortunately that's even with family members that do live separately, unless it's for the reason of childcare or religious reasons. And so you've probably seen videos of family members that are even neighbors having dance-offs but across the street from each other, or doing funny things through the windows or from each other's porches. And so creating, again, that social buffer, even with our own families and close friends and neighbors, is very important because of how infectious and contagious this thing is. And that's how we're going to be able to prevent a huge surge in cases, is by limiting those exposures only to those that are absolutely necessary for taking care of essential services.
The other thing I would add is that if you do have someone within your home, within your family that is an essential worker, such as a healthcare provider who's getting exposed, working on the front line, then what we're recommending is, at least when that individual comes home, changing clothes at work, and maybe showering at work, or changing clothes and showering immediately when they get home. Um, and if they think that they've been exposed, many families have reached out and asked what to do. And we are recommending trying to quarantine if possible. So staying away from family members, especially at-risk family members who would be at risk for severe disease, like an elderly parent who lives in the home, or an individual with PWS who could have a severe course, that individual, at least for 14 days from the day of likely or possible exposure, keep to themselves.
Thank you. We have a question from Dawn wanting to know if someone with PWS were to get COVID-19, should growth hormone be stopped?
This is a tough question for us to answer because we may not be the right specialists, but what that is very center dependent. Certainly, what I've heard most endocrinologists say is that if your child is in the intensive care unit, particularly if they're on a ventilator in severe condition, that growth hormone should be stopped. Um, I would definitely, though, defer to the specialist in that particular hospital where you are, or your regular endocrinologist, to make that decision.
Thank you. Sarah wants to know, with a high pain tolerance, what can we do if we cannot see symptoms in our child with PWS?
I think part of that, the answer to that, is what um, Dr. Hawkins said as well, about knowing your child and what your child usually acts like, what their temperature usually is, and making sure that medical providers hear you if you feel like there's been a change. Um, Testing for COVID-19, of course, is very challenging. One, because of the shortage of tests, but two, there is about a 30% false negative rate. And so I, I Dr. Hawkins might have a different thought about this, but testing early for COVID-19 may or may not be helpful in and of itself, um, but making sure that you're educating providers that you're seeing if you feel like there's been a change from baseline. The other thing is that one of the things we notice with individuals with PWS is that difficulty breathing tends to be the same as what you see in other individuals. So that fast breathing rate that was mentioned can be really helpful to monitor for. Other signs of increased work of breathing, like the nares of the nose flaring in and out, or pulling in and out of the chest, those are signs often that are the same in PWS as they are in typical individuals that could indicate that there's a respiratory infection.
And I would agree with that completely, and would emphasize too that if you are in a position where you're worried about your child showing some signs that might be a little bit atypical, but that they are not in respiratory distress, that they're responding appropriately, they're not lethargic, not truly lethargic, then that's a child, that's a patient that we would not necessarily even suggest you have seen or tested, where we are not suggesting that you test because it may not necessarily, number one, be practical, doable, and it may not necessarily change the outcome, except to think about how that is being spread, and you potentially are placing yourself and others at risk of spreading or catching it if you don't have it in the first place, if you are going into an environment like an emergency room that might have more exposure in that place. And so avoiding those unnecessary contacts, and recognizing that though some of the signs might be different and subtle, that the respiratory symptoms are going to be prominent and are going to be the main thing that we're worried about anyway.
Thank you. We have Vanessa, who is an individual with PWS, and she was wondering what factors might come into play where someone who has the virus recovers versus another person who catches it and passes away.
Vanessa, hey, that's a great question. And age really does seem to be the most significant factor. There may be some gender differences as well, where it seems as if men are tending to pass away with it more. And then having uncontrolled or particularly bad weight issues or hypertension issues, significant strains on the heart. But again, it seems to be that it is the overwhelming respiratory part of it that is what's really placing these people at risk for not surviving.
Okay, we have only just a few more questions left. Maggie would like to know if you are aware of any pediatric trials that are testing children that have been sick and are now well enough to see if they have COVID-19 antibodies.
So this is a great question, and this is something that Children's Hospital Colorado is claiming quite novel credit for, where they are taking plasma from large populations and are using that to create it's essentially pooled antibodies to do exactly that. And so yes, that is coming. That is different from vaccinations. And that is actively being used here in Colorado, and I believe is being explored in many places. I do not know the details of how it is being studied, but I would ask you to use the references that Dr. Duis had suggested to look for an area, a site that might be available locally if you have more interest.
All right, and our final question is from Stephanie. She would like to know, what is the balance between receiving routine care that cannot be completed via telemedicine versus self-isolating our PWS child? Is it more important to get him in-person care or to keep him at home?
I would say, depending on what the concern is, many things can be addressed via telehealth, more so than we thought. So I think my thought would be to start with a telehealth visit and then see if your child needs to be seen, and actually have the provider ask them when you have that telemedicine visit whether they think it's important enough to risk exposure going physically to the doctor. The one thing I will say is that a lot of hospitals are actually pretty empty right now. So some of my colleagues have joked that the hospital might be the safest place to be because we're disinfecting constantly. Everybody's now wearing masks if they come to the hospital and getting screened for symptoms. The one thing we can't protect against is the people that are asymptomatic that may be spreading it that don't even know that they have it. So I would encourage, if it's not urgent, to wait until the pandemic has started to clear more to go for an in-person visit.
I would add on to that and say that our practice has been very active in doing telemedicine, in that I have personally been referring many of my patients then for pulmonary function testing, chest x-rays, etc. And they, as a result, they did have to come in eventually, but they still saw or had a physical experience with fewer people in the waiting room, fewer people in terms of medical staff. And instead of having to go to check-in and then to the vitals room and then in clinic and then down to the lab, etc., they only had to go to the one place for their lab work or their chest x-ray. And so even in that way, the telemedicine helped streamline their care and focus on exactly who they needed to see and reduce the number of potential exposures they had and others had.
Fantastic. It looks like we don't have any more questions from our attendees today, so thank you once again to our presenters, Dr. Duis and Dr. Hawkins, for a very informative presentation. If you have any additional questions for our presenters, please submit them to info@pwsausa.org, and we will forward your email along. You can also keep up with the conversation by joining one of our many Facebook support groups. Just send us an email again at info@pwsausa.org if you would like to be added. After the webinar ends, we would invite you to take a brief 5-question survey to let us know how we did. A recording of this webinar will be available for anyone who missed today's presentation or would like to watch it again. Our next webinar is scheduled for Monday, April 27th at 7 p.m. Eastern. We invite you to join PWSA USA and FPWR for this live informational webinar to learn more about our combined efforts to support and accelerate PWS research. An invitation to attend will be sent out via email, so check your inboxes. Thank you again to our presenters. Stay safe, everybody, and have a good evening.
Thank you.
Thank you all very much. Take care.